You're in the middle of an intimate moment, and suddenly the penis loses its rigidity. This can cause frustration and affect confidence, but understanding the causes of the situation is the first step to overcoming the problem. I am Dr. Costa, a urologist, and today I will explain what really happens when this occurs during sex. Several factors can interfere, such as stress, health conditions, and even the side effects of medications. Identifying what is behind this issue allows you to find ways to improve performance and prevent this from continuing to happen. With clear and accessible information, you will be able to regain your peace of mind and transform your experience positively. Before continuing, make sure you are subscribed to the channel so you don't miss more tips on health and sexual education. If you found the topic relevant, leave your like and participate in the comments. Write a 1 if the topic made sense to you, or a 0 if you have any doubts. Your opinion is important so that we can offer increasingly better content. The human body functions as an integrated system that depends on precise signals to act. In the case of an erection, these signals begin with sensory stimuli, something you see, hear, feel, or even perceive with your sense of smell. These stimuli activate the brain, which acts as a control center, sending orders for the body to prepare. When this happens, the parasympathetic nervous system comes into action. It is responsible for slowing down the body, reducing stress, relaxing the muscles, and directing blood flow to specific areas, such as the blood vessels of the penis. These vessels dilate, allowing blood to flow efficiently, which generates and maintains the erection. It is as if the body were a well-adjusted mechanism where each part must collaborate for everything to function. However, if something interrupts this harmony, such as a negative thought or a distraction in the environment, the process can stop. Therefore, in addition to adequate stimuli, it is essential for the man to be relaxed and free from distractions, allowing the body to respond naturally and efficiently to these signals. Do you want to revitalize your sexual life and strengthen the connection in your relationship? In the digital book Rediscovering Intimacy, Healthy Sexuality After 60, you will find practical tips to rekindle desire, overcome obstacles, and build a deeper connection. Check the link in the first pinned comment and discover how small changes can transform your love life. The nervous system is like an electrical control center that connects the brain and the body, ensuring that everything functions in perfect synchrony during sexual activity. The parasympathetic system is the protagonist. It comes into action when the body is in a state of relaxation, sending signals to release chemical substances that promote the dilation of blood vessels in the penis. This relaxation allows blood to flow and fill the cavernous bodies, creating the erection. However, if the sympathetic system, responsible for states of alertness and stress, takes control, the effect is the opposite. It contracts the blood vessels, redirecting blood flow to other parts of the body, such as the muscles and the heart, which prepare for fight or flight situations. In moments of anxiety, worry, or even surprise, the sympathetic system can interfere, blocking the erection process. For example, a man may be in an ideal environment, but an intrusive thought, such as remembering a financial problem, can activate this state of alertness. In this situation, the parasympathetic system loses strength and the erection can fail. Therefore, being relaxed and in a safe environment is essential for the nervous system to work in favor of, and not against, sexual performance. Psychological stress acts as a true saboteur of sexual performance. During the act, the brain must be focused on the stimuli that provoke pleasure, but when negative thoughts or worries steal attention, this happens because stress activates the sympathetic system, which puts the body in a state of alertness, inhibiting the parasympathetic system responsible for relaxation and erection. External situations can also trigger this blockage. An unexpected noise, such as someone knocking on the door, or an unpleasant memory can activate emotional triggers that divert focus. For example, a man may associate a past uncomfortable experience with an ex-partner with the current moment. This association generates tension and can interrupt the erection process. Additionally, everyday problems such as overdue bills, family conflicts, or grief create an emotionally charged state. When these actions enter the room, even subtly, they directly influence the ability to relax. A man may have received adequate stimuli at first, but stress becomes an obstacle to maintaining performance. Therefore, Mental health and the environment in which the act occurs are so important to prevent stress from becoming a barrier in the most important moments. Chronic diseases such as diabetes and hypertension can directly compromise the mechanism that supports a healthy erection. In the case of diabetes, the problem begins in the nerves and blood vessels. High blood glucose levels, when not controlled, damage the nerves responsible for transmitting signals from the brain to the penis. Additionally, blood vessels harden, reducing blood flow and making it difficult to achieve and maintain an erection. Hypertension also causes similar damage. Elevated pressure hardens and narrows blood vessels over time, making blood flow to the penis difficult. This makes the erection process less efficient, even when the stimulus is present. Additionally, medications used to control blood pressure, especially diuretics, can reduce the erectile response. These conditions, when combined, further increase the risk of erectile dysfunction, especially in men over 50. Adequate control of these diseases is essential to minimize impacts. Reducing blood glucose and maintaining blood pressure at healthy levels helps preserve the integrity of nerves and vessels, allowing the body to respond better to stimuli during sexual activity. Certain medications can significantly interfere with the quality of the erection, even when there is a stimulus present. Medications used to treat hypertension, such as diuretics, are common examples. They help control blood pressure but reduce the blood flow that reaches the penis, making it difficult to achieve the necessary rigidity. Additionally, they can decrease zinc levels in the body, affecting testosterone production, a hormone essential for sexual desire. Psychiatric medications, such as antidepressants, are also known to alter sexual function. They act on brain chemistry, regulating emotions, but many times block sexual stimuli, delaying or preventing erection. This can be frustrating, especially for men who are already dealing with performance-related anxiety. Medications to treat prostate problems, such as 5-alpha reductase inhibitors, also have an impact. These medications reduce testosterone levels and, consequently, sexual appetite, in addition to directly affecting the erectile response. In all these cases, it is fundamental to talk to the doctor to evaluate alternatives or adjustments in dosage. Proper follow-up can balance the treatment of the health condition with the maintenance of sexual quality of life. The use of medications such as tadalafil, sildenafil, and other options can be an effective resource for men facing erectile difficulties. These medications act as vasodilators, increasing blood flow to the penis, which facilitates the rigidity necessary for sexual activity. However, for them to be truly effective, it is fundamental to use them correctly and under medical guidance. The daily administration of low doses, such as 5 mg of tadalafil, is a common strategy for men who wish to improve their sexual response continuously. This method allows the body to maintain consistent levels of the substance in the blood, favoring more reliable performance. On the other hand, sporadic use before sexual activity requires an adequate interval for the medication to reach its maximum effect. Self-medication or increasing the dose on your own are dangerous practices. Excess can cause serious side effects, such as sudden drops in blood pressure and heart problems. Additionally, the medication only works effectively when there is sexual stimulus. Therefore, it is essential to combine its correct use with the creation of a relaxing environment that allows the body to respond naturally to the stimulus. Self-medication and overdosing on erection medications can cause more harm than good. Many times, the anxiety to obtain quick results leads the man to ignore medical recommendations and increase the dose on his own. This can trigger serious problems, especially because these medications, such as tadalafil or sildenafil, have a vasodilating effect that, in excess, can compromise circulation and cause dangerous drops in blood pressure. When used inappropriately, these substances can provoke the opposite effect to the desired one. Instead of improving penile rigidity, excessive vasodilation can reduce blood flow, causing dizziness and making the erectile response difficult. Additionally, indiscriminate use can mask more serious health problems, such as cardiovascular diseases that require immediate attention. Another risk is the development of side effects, such as headaches, dizziness, and nasal congestion. In the most extreme cases, serious cardiac complications can occur. Medical guidance is essential to determine the correct dose adjusted to the needs and health of each individual, Avoiding excesses and following the indications are fundamental steps to ensure the safety and efficacy in the use of these medications. The adjustment of medications to treat erectile dysfunction is a fundamental stage that must be carried out with medical accompaniment. Each organism reacts differently to medications, and factors such as age, weight, health status, and the presence of comorbidities, such as diabetes or hypertension, directly influence the response to treatment. Therefore, what works for one person may not be effective or safe for another. Many times, an initial standard dose, such as 5 milligrams daily of tadalafil, may be sufficient for some men, while others may need adjustments. The doctor evaluates the response to the medication and, if necessary, can increase the dose or recommend safe combinations of substances. This process ensures that the patient achieves the desired effect without running risks. In the case of men who use other medications, such as diuretics or antidepressants, medical accompaniment is also essential to avoid interactions that may harm health or sexual performance. The doctor can suggest less impactful alternatives or adjust schedules and dosages. This personalization in treatment not only improves results but also reduces the risks of side effects, ensuring comprehensive care for sexual health. Specific lifestyle changes can directly impact the quality of the erection. A frequently overlooked point is the quality of sleep. Sleeping poorly interferes with testosterone production and hormonal balance, both fundamental for sexual performance. Establishing a consistent sleep routine and prioritizing a quiet environment for rest can bring significant improvements. Additionally, adequate hydration is another important factor. Dehydration can affect blood circulation and energy levels, impairing the body's response during sexual activity. Drinking water regularly contributes to the organism functioning efficiently. Another practical adjustment is to include relaxation techniques in the daily routine. Methods such as diaphragmatic breathing or specific stretches help reduce muscle tension and activate the parasympathetic system, promoting a more favorable state of relaxation. Lastly, investing in hobbies that provide pleasure and mental relief, such as music, reading, or gardening, can improve emotional well-being. When the body and mind are aligned, sexual performance reflects that harmony, creating a solid foundation for a more satisfying and stable intimate life. Now that we have addressed the factors that can cause the loss of penile rigidity during sex, from emotional issues such as stress to health conditions such as diabetes and hypertension, I want to know which of these points you think affects your life or the life of someone you know the most. Share your experience in the comments. This can help many people who are going through the same thing. If you like the content, click like. This gesture is fundamental so that more men can access information like this and seek to improve their sexual health. Explore other videos on the channel for more tips on male sexuality and health. There is always something new that can make a difference, and if you haven't subscribed yet, take this opportunity to join our community so you don't miss any new content. A hug and see you in the next video.